Yes, so I'm honored to be representing the U.S. Multiple Myeloma Immunotherapy Consortium and presenting our poster here at the International Myeloma Society meeting in Athens, Greece. Our poster is an update of our data regarding the outcomes after various different bridging therapies prior to ide-cel CAR-T for relapsed refractory myeloma. And in our study, we compared patients who had no bridging therapy versus those that had received one of 4 different subgroups of bridging therapy. And also we just compared no bridging therapy with any of those bridging therapies. We had a total of 214 patients that were analyzed from 11 different cities across the US in the consortium. And out of those, about 170 or so received bridging therapy. And when we looked at the outcomes, there was no difference in response rates between bridging and no bridging therapy, 84 versus 88%. There was no difference in CRS or ICANS toxicity. However, there was a significantly inferior progression-free and overall survival rate with bridging therapy prior to ide-cel. When we looked further into that, we divided the bridging therapy into 4 groups, either IMiD plus or minus monoclonal antibody therapy or proteasome inhibitor-based therapy versus selinexor-based bridging therapy versus alkylator-based. And out of all those, the monoclonal antibody plus or minus IMiD had the best outcomes, similar to no bridging therapy, whereas the alkylator subgroup had the most inferior progression-free and overall survival. And so it just leads us to caution in the role of, in the selection of bridging therapy for these patients. It does not by any means say that we cannot use alkylator bridging therapy or that we shouldn't if we need to. It probably reflects the biology of the myeloma going into CAR-T. For example, the patients that did not receive bridging therapy probably had the most indolent or least explosive relapses, and those that received the most aggressive bridging therapy with alkylators probably had become refractory to the most options and no other good options and more rapidly dividing disease. However, it does underscore the need to think about using CAR-T as early as possible before patients have used up all of their options and need to resort to alkylators, and hopefully helps further support the advancement of CAR-T cell therapy to earlier lines of therapy down the road here.